back to the petition. So the petitioners are asking the hospital to temporarily reduce elective surgeries and non-emergent admissions to alleviate the strain on resources and prioritize care for critical patients. This also reflects the fact that Ascension was not prepared or had contingency plans to deal with this cyber attack. Ascension, like many businesses in the modern day and age, adhere and abide to what is called just-in-time production standards. That means that every second and minute of the business day is scheduled, booked, sometimes double booked, and assembled to run like highly complicated clockwork. They cannot handle kinks, curveballs, or any minor alterations to their plans. So something like this cyber attack comes along and it may lead to an unrecoverable situation. This shows the fact that Ascension is structured to make money. It's all about the money. Now put up another review of an urgent care. They're processing 100 patients in a 12-hour shift, $175 a pop. So the closing of the petition, these safety precautions are essential to safeguarding the well-being of both our members and the patients we serve. During this challenging time, it is imperative that the hospital administration takes immediate action to address these concerns and prioritize the safety and quality of care for all individuals involved. It reads, "We, the undersigned, stand united in demanding these safety precautions be implemented without delay and call upon the hospital administration to prioritize the well-being of both staff and patients through this challenging period."
You've reached the Ascension System Office General Mailbox. After the tone, leave a detailed message and someone will respond to your call. Thank you.
I'm trying to reach CEO Joseph Impicciche, and he can contact me at that number, and I have a message that I would like to give to Ascension. Between 2018 and 2019, I was an emergency department patient at Ascension St. Vincent's East Hospital in Birmingham, Alabama. I believe I had broken my neck. I had an x-ray, 2 CT scans, and later an MRI looked at by Ascension St. Vincent's doctors. Each time they had told me I had no injuries in this area, I knew their diagnosis was an error as my condition worsened. The area became infected and infested with parasites. By summer 2019, I almost died. I obtained my medical records from your hospital along with the x-ray, CT, MRI imagery, and discovered the truth of my injury. I had broken bone in the underside of my skull in the area of the condylar canal and occipital condyle. How the doctors could have missed such a large and serious injury over multiple hospital visits is inexcusable. I believe some element of organized corruption may exist in this hospital. I have compiled over 10 hours of video documentation on what happened to me on my YouTube channel, and the name of the channel is My Medical Nightmare. I believe I may have been a victim of patient dumping in the course of my seeking treatment, which is a violation of EMTALA, E-M-T-A-L-A. When I told medical staff associated with Ascension about my discovery that I had been misdiagnosed repeatedly, I was personally attacked and my psychological state was challenged, and this is reflected in medical records I obtained later. I could not obtain proper treatment or diagnosis for this injury because doctors and nurses that I would subsequently have encounters with would only entertain what the erroneous Ascension ER findings were. My mother, who was a nurse for 20 years, had the misfortune of working in an Ascension hospital. When I questioned my MRI findings involving St. Vincent's Ambulatory Healthcare Network, LLC, and Dr. Michael Brandt Ruff, MD, radiologist, in March 2019. My mother, who was a nurse for 20 years and worked in the Ascension Hospital, she was terminated from her job there around the same time. And so this phone call, I challenge the misdiagnosis of Ascension St. Vincent's East Hospital, Birmingham, Alabama, and I challenge the policy of this hospital. And Mr. Impicciche, I think you need to look into this, please. Please listen to my message, look into what I'm saying, and you're free to contact me. Thank you.